Australia has a population of 24.5 million people. In the last 50 years, the number of people who are 65 years and older has tripled. And these people, even though they only make up 13% of the population, currently they're 40% of the hospitalisations. There's about 342,000 people with dementia. And 1 in 10 older than 65 have dementia, and this increases to 3 in 10 over 85. 7.8% of Australia's population who are over 65 actually live in residential aged care facilities. And it's estimated that it's greater than 50% of these people have a diagnosis of dementia. The Australian Centre for Evidence-Based Aged Care, which is commonly known as ACEBAC, is a research centre located at Trobe University in Victoria in Australia. We're an externally funded research centre, meaning that we have to apply to get research funds, and we do a lot of contract research for governments, both federal and state. Our aim is to improve the care and quality of life of older people, and especially people with dementia. Prime consideration is that what we generate is actually understandable, meaningful and usable. We do the traditional research outputs, peer-reviewed journal publications, book chapters, national and international conferences. We also have developed assessment tools, surveys that are based on research, developed a whole lot of consumer resources both for families, older people and people with dementia, and also for healthcare providers as well. Several of these projects that we've undertaken have been commissioned by the Victorian State Department of Health and Human Services. One of the first projects that we undertook was to actually develop a suite of quality indicators for residential aged care in Victoria. Pressure injuries, unplanned weight loss, physical restraint, falls and fractures, and the use of 9 or more medications polypharmacy. So these were piloted in 2005 and then they were rolled out across the state. And now there's been a national rollout, and it was actually mentioned in an OECD report. We then undertook another project which had an acronym of SCORE, which was Strengthening Care Outcomes for Residents with Evidence. It was around working out what was best practice and implementing best practice. We were able to define clinical risk, and then through a whole lot of public consultation around Victoria, we identified 18 clinical risks for older people living in residential aged care, gradually developing up standardised care processes. The Comprehensive Health Assessment of the Older Person Education Program was commissioned by, again, the Victorian Department of Health and Human Services for us to develop up a 4-day education and training program. And this was in response to some needs for education and training for nurses caring for older people across the health sector in Victoria. We've developed up a program which has got 8 modules, which include clinical reasoning, psychosocial assessment, nutritional assessment, elimination, respiratory. So we've educated nearly 2,000 nurses.
A lot of our projects evolve from one another. The Recognise and Report project really arose out of the Comprehensive Health Assessment project, where we identified that registered nurses needed more education. Personal care workers working in residential aged care provide the majority of direct care to older people. Having them being able to recognise any deterioration in an older person's health status really is important, because they can report that and the appropriate management can be set in place. What we found though is that personal care workers in Australia have very varied education and skills. We went out to different facilities in the rural areas and metro, and we interviewed personal care workers, managers of facilities, registered nurses to see what the issues were. And then we developed the education identified in this research, and then we took it back to the sector. And managers and nurses reported that there was increased confidence amongst this care group, early reporting of urinary tract infections or breaks in skin, all important indicators to institute the appropriate care plan for older people.
It became apparent that sexuality was still an area that many aged care facilities struggled with. There was really a paucity of education and policy, and there are a lot of myths and stereotypes around about older people and sexuality. So we set about developing a program of research to really better understand what the issues were and how we could better support aged care facilities.
We conducted a survey of all Australian government-funded residential aged care facilities. In terms of policy, we found that only 1/4 of facilities reported having a written policy on sexuality or sexual health, And of that quarter, only 7% were able to provide written evidence of having such a policy. We found that about 40% of staff had received training within the 2-year period prior to the survey, but just as many reported that they had never received training in this area.
The findings allowed us to develop an assessment tool. The Sexuality Assessment Tool allows an aged care facility to rate themselves against a number of items: policies, the needs of residents, staff education and training, information for residents and families, the environment itself, and safety and risk management. The Sexuality Assessment Tool allows an aged care organisation to really determine how supportive they are of residents' expression of sexuality and in what areas they might need to make some improvements or changes. And it also allows them to track that progress over time. We developed a booklet for partners and carers of people living in aged care facilities. We've also developed up a short animation which is available online.
Some of you will know our residents, Betty and Harold, who have formed a relationship.
And this animation depicts a scenario in an aged care facility involving a resident who forms a new relationship. It's a framework for further discussion about the topic of sexuality in aged care. It's also a useful resource for families.
Dementia Training Australia is a consortium of 5 universities and Alzheimer's Australia, and we have a strong focus on wellness and quality of life rather than focusing on the disease itself. ACEBAC's role in the consortium is that we lead the medical professions training programs, so we do a lot of work with general practitioners across the country and with hospital doctors and developing resources and training programs.
Dementia Training Australia have developed a fellowship program that supports knowledge translation and the improvement of practice in the care of people living with dementia. We work with staff in the Australian aged care organisations to plan, manage and evaluate knowledge translation projects in areas that they feel will improve the quality of care in their workplace. We ask the organisations to nominate 2 or more fellows who are leadership ready to undertake the fellowship. What we really need to do now is engage with aged care systems so that we can make practice improvements sustainable.
We're always looking for international collaboration with a lot of the work that we do, because we understand that the issues and needs of an ageing population, it's not just Australian-centric, and that these are common worldwide issues.